Hello, everyone. My name is Katelynn, and I'm excited to share with you a proposal for the new community-based initiative called ElderNet. So this program is designed to address social isolation among older adults. Social isolation doesn't just affect emotional well-being, it has direct consequences for physical and mental health, increasing the risk for serious conditions like heart disease, depression, and even cognitive decline. So the goal with ElderNet is to really bridge the gap to create a community where older adults feel connected, supported, and empowered. And then these next couple slides, I'll talk about how we can make that happen. So before we get started, what exactly is social isolation? So social isolation refers to the lack of meaningful social connections and engagement with others. So it's more than just being alone, right? It's about the absence of a supportive network, which then can lead to loneliness. So in the case of older adults, this can have significant effects on their physical and mental health. According to the CDC, loneliness in older adults is linked to higher risks of heart disease, depression, and even early mortality. So let's take a quick look at the numbers. Approximately 25% of older adults age 65 and older are socially isolated. So that's one in every four seniors. And in rural areas or even underserved urban communities, the rates are even higher due to transportation barriers, fewer support services, and even cultural and language isolation. So, with our aging population continuing to grow, this is not a problem that we can afford to just push off and ignore anymore. Without strategic interventions, these individuals may face compounding effects like higher healthcare usage, increased mental health struggles, and even a diminished quality of life overall. So, this program is really aimed to change the trajectory of all that. Now, you might be thinking, why should I care? Why is it my problem? Well, as social workers, we are trained to focus on improving well being through resource access, advocacy, and support. So, social isolation falls directly into what we're supposed to be helping people with. By addressing this issue, we can help enhance mental health outcomes, improve access to resources, and create more supportive communities for older adults. And this aligns with the NASW Code of Ethics, which emphasizes social justice and enhancing the well being of vulnerable populations. Now, let's take a look at the research. Several studies show that social isolation leads to higher mortality rates among older adults. So, the literature clearly shows that isolation isn't just a mental health issue, it's a public health issue, especially for older adults in hospital settings. The combination of illnesses and disconnection can lead to serious declines in mental and physical health. But more importantly, the research also tells us what does work. So, Gardner 2018 found that programs which support peer support, structured activities, and community engagement significantly reduce feelings of loneliness and improved overall health. So, even modest interventions like just regular phone check ins or even hobby clubs, they can make a meaningful difference. And this just gives us a solid foundation for designing a program that isn't just hopeful or just isn't thrown out, but it's actually evidence based practice. So, what are the potential gaps in research and also room for innovation for this program? So, one, there is limited research in hospitals currently, as most studies focus on older adults in the community rather than in the hospitals. There's also no standard tools for screening social isolation in these healthcare settings. There's also a need for discharge planning. So we can continue these social connections once the patient leaves the hospital. However, there are opportunities for teamwork across different fields between the doctors and nurses and for social work led initiatives. So while there is a solid foundation, many hospitals still overlook social connection. So social workers can create programs that treat social health as equally important as physical recovery. So, what is ElderNet? It's a comprehensive program built around connection, empowerment, and access. So, we'll offer community events tailored to senior interest, peer mentorship to build meaningful relationships, educational workshops on health, aging, and well being, and to have a dedicated outreach team that helps seniors access resources like transportation, food, and even healthcare. So, this isn't a one size fits all program. It's very flexible, inclusive, and designed to adapt to the needs of different communities. So, really, ElderNet aims to address both immediate and long term isolation issues by using volunteers, technology, and social work expertise. So, this program combines both social interventions with changes to the system to create a more connected hospital setting. So, as social workers, we draw on different theoretical frameworks to guide these interventions. So, the ecological systems theory is particularly relevant here, as it really just emphasizes the interaction between individuals and their environment. So, by providing community based resources, we can create more interconnected and supportive environments for these older adults. We also can lean on the strengths based practices, focusing on what older adults can do and the assets that they are already have in their communities. So, what is already present that they can use. And this really just gives everyone confidence, the right to their own decisions, and long term engagement. So, as I mentioned earlier, the ecological systems theory will guide this program by focusing on improving the social environment of older adults. The strengths based approach will play a vital role by leveraging existing communities' resources and the strengths of the seniors themselves. We empower these individuals to take charge of their own well being and reduce the sense of isolation that they may feel. It's also more hands on for the different people involved in this process. This work aligns closely with the NASW Code of Ethics. We're promoting social justice, enhancing dignity, and fostering human relationships. So we'll uphold confidentiality, respect informed consent, and ensure services are accessible to all older adults, regardless of income, ability, race, or background. So, cultural competence will also be a very, very, very key focus here, making sure that the program is inclusive and responsive to diverse traditions and values so that every single person can be involved. So the four M's of age-friendly health systems are very, very crucial to ensuring that the older adults receive comprehensive and compassionate care, right? We want both. So we'll incorporate this by one, what matters. So we'll focus on understanding the personal goals and preferences of older adults, making sure that the services align with what's most meaningful for them. And two, medications. We'll offer education on managing medications, reducing polypharmacy, and enhancing medication adherence. Three, mentation. So, cognitive health is crucial and will provide mental health support to reduce isolation and improve cognitive functioning. And four, mobility. We will help older adults improve mobility through physical activities and connect them with resources that promote mobility and independence, especially when they transition out of the hospital back into whatever home environment that they are, giving them the resources to stay mobile during that time. So, ElderNet will begin by conducting a community needs assessment to understand what older adults in the area are missing and what they want most. Next, we'll identify accessible locations for this program, recruit and train volunteers, partner with local clinics and senior centers, and then launch like startup workshops on mental health, tech use, and connecting with community resources. So, it's all about building trust and creating low barrier opportunities to connect before we can start expanding the reaches. How are we going to get the word out for this new program? So to make sure that everyone has access, we were going to use multiple outreach methods and not just one. So this includes social media, flyers at local health centers, and obviously word of the mouth through healthcare providers. We'll also establish a helpline for seniors to learn more about the program and to sign up. So this will be especially important for those with limited internet access. So the goal is to get as many means as possible, because not everyone has the same source of communication. So really just trying to tick off every box to make sure everyone has been informed. Collaboration and response is so crucial for this program. Without it, I don't think the program can really exist. So we anticipate positive collaboration from healthcare professionals by partnering with primary care physicians, geriatric specialists, and mental health counselors. We can make sure we have a holistic approach to this care. We'll also provide training for professionals on recognizing the signs of isolation in older adults and how to refer them to our program. And we're going to also focus on trauma-informed training and trauma-informed care, because you don't know everyone's situation and or backgrounds. So making sure everyone is properly trained to handle any type of situation. To launch and sustain the ElderNet program, we're going to need a variety of resources, including trained volunteers, space for activities, and funding for these materials. And for this funding, we'll seek it from grants, local businesses, and nonprofit partners. We'll also rely on the support of healthcare providers who can not only donate their time, but also their expertise to this program. Social isolation affects people differently depending on race, income, and language. So we'll ensure racial equity by designing programming that reflects community demographics and hiring staff from diverse backgrounds. We'll also advocate for policy change, pushing for more funding for aging services in marginalized communities, and encouraging culturally competent care models that respect all lived experiences. So while everyone may experience social isolation differently, everyone can be affected by social isolation. So social isolation can affect anyone no matter what. But everyone will have a different take on social isolation based on what they've been through. We'll evaluate ElderNet based on different patient-centered outcomes, program process evaluation, and hospital metrics. So the evaluation will look at both the results for patients and how the program is put into action. By tracking patient feedback and hospital data, we can make sure the program is helping reduce social isolation and improving overall well-being. ElderNet success will be measured through both quantitative and qualitative data. So, surveys like the loneliness scale and the geriatric depression scale, pre-post program interviews with participants, tracking attendance, engagement, and health service usage, and most importantly, just feedback from everyone. So, this data will guide adjustments to the program and demonstrate impact to the people who are volunteering their time and even funders. So, how does this relate to other setting and community resources? So, the success of this program relies on building connections between hospitals and the local community. So, we can use local organizations, technology providers, and healthcare systems to make sure the program reaches as many people as possible. What about the government and agency partnerships? So, we're going to be working with these agencies to not only provide financial support for the program, but to also help push for bigger challenges that tackle social isolation and healthcare disparities for older adults. Finally, this program will build on existing resources in the community, will partner with local aging services, healthcare providers, and community organizations to make sure that the program remains stable. And additionally, we'll explore opportunities to work with governmental agencies like the Department of Aging to align with national initiatives addressing isolation and improve funding for ongoing efforts. So overall, the ElderNet program represents a crucial step in addressing social isolation among older adults. By providing comprehensive support and fostering a sense of belonging, we can really improve health outcomes and enhance quality of life for seniors. Thank you for your time, and I look forward to answering any questions that you may have.